Since the news that the Supreme Court overturned Roe v. Wade, online searches and general interest in so-called abortion pills are at an all-time high. In the United States, over 50% of all terminations are what we refer to as medication abortions or medical abortions. So as a board-certified OB-GYN, I'm going to tell you everything you need to know and bust some myths and misinformation right here. So in the United States, a medication abortion is 2 drugs given about 24 hours apart orally and has an efficacy rate in the mid to high 90% range. It is only FDA approved up through 10 weeks of pregnancy, so about 70 days gestation. Is it painful? Yes, absolutely, it can be painful. We normally describe this to women as more painful than your most painful period. For some women, they might describe it as the worst pain they've ever experienced, but that's a spectrum that's, of course, very subjective. We normally will prepare women to expect very heavy bleeding, very heavy cramping. We manage this pain in a home environment, typically with Tylenol or some over-the-counter pain medications, but the cramping typically can last anywhere from 4 to 6 hours to over a day, and the bleeding in some cases, in variable degrees, can last for as much as 2 weeks, even to some degree up to a month when you're talking about light bleeding or spotting. No abortion is 100% effective, so generally we recommend that women either self-monitor for resolution of that pregnancy, possibly do a home pregnancy test 2 to 4 weeks later, and monitor themselves for any fever or signs of infection, which have been reported with medication abortions, but they're generally uncommon. The overall complication rate is cited at less than 1%. And for many women, the logistical freedom that a medication abortion or termination provides is ideal / preferable. Privacy of their own home, no need to travel and pay for anesthesia expenses or surgery fee that could sometimes accompany a surgical termination. So many people also asking about telehealth, telemedicine, whether they could get abortion pills by mail after a telemedicine encounter or interaction. Yes, at the end of 2021, the FDA did approve abortion pills to be sent by mail via telemedicine or telehealth. However, after the Supreme Court ruling, that is in flux with respect to each state. What I would recommend is that women check with the gynecologist or their clinic for the latest legalities with respect to termination of pregnancy, whether that is done surgically or medically. For a woman who may be considering medication abortion, I think it's very important to understand that it is not one size fits all. There are pros and cons to this approach when compared to a surgical abortion or suction D&C. It depends on the situation that the woman is in, both socially, logistically, work-wise, family-wise. It also is important to factor in any pre-existing medical conditions. In general, women with bleeding disorders or any type of significant clotting history would not in general be a candidate for a medication abortion. But this is why the practice of health and our reproductive health, just like any of our other health practices, should not be left to a layperson to figure out. Ideally, this is a conversation or a dialogue that a woman can have after an informed consent medical counseling encounter, whether that occurs in person or virtually, digitally via telemedicine.